Hi, this is Pat Iyer, and I am talking with attorney and nurse practitioner and LNC Joe Flores, who has presented at our two prior legal nurse consulting virtual conferences. And we are bringing Joe back today in this video so he can talk about the topic that he'll be covering in our March 4, 5, and 6 virtual LNC conference, our third one. Joe, what are you going to be covering in your session at the conference?
Well, thank you, Pat, first of all, and everyone else who supported this. I think that doing this online can be just as beneficial as in person. As you know, I have been a federal attorney for 2 decades. And of my career, I've worked with federal, state, and local officials on trying to abate the opioid crisis. What we're looking at is the measures that are being taken by law enforcement, by our healthcare providers, and also by governmental entities that are trying to stop this epidemic that is going on. I, in fact, have met with international leaders in South America and Europe and have talked about the measures that those that are under the microscope right now, such as big pharmaceutical companies, their interventions in order to keep spreading the sale of pharmaceuticals throughout these United States as well as South America and Europe. And I found out some interesting things that I'm going to be sharing with you all in March. Number one that we need to remember is that this crisis is not going to be going away very soon. So as nurses, as LNCs, and as healthcare providers, we need to remember that this is a very important topic. What's more, we'll learn measures that we can do that can empower us, not only working politically, but also geopolitically, and also working with other healthcare providers to put a stop to many of the problems that have happened. As you know, Pat, I've told you that the shortage of, or the expense and the access of getting those pain medications has been affected dramatically since November of 2014. This has led to individuals looking for a cheaper route to obtaining the same high. I'll be covering that after interviewing law enforcement officials, federal and state, and sharing their information, as well as looking at it through the lens of healthcare providers. These individuals sometimes become heroin addicts. It's led to a pandemic of overdoses. Okay, and we can't forget about the pandemic of opioid users because we're focusing on COVID-19. Those individuals are linked directly to what we're going on about when we talk about COVID-19. We're talking about social isolation, depression. We're talking about loss of income. Those individuals are the ones that are prone to be looking for heroin as an outlet because there are no longer any pharmaceutical drugs to speak of. And those pharmaceutical drugs on the street are being sold for 5 to 10 times the amount that you could ordinarily get them. This have pushed those users to go onto the black market and even turn to heroin, unfortunately. So we'll be covering those issues. Third, we'll talk about law enforcement and their coordination with healthcare providers and what you can do. And lastly, those legal nurse consultants seeing opportunities where we can help solve that opioid crisis. And I'll be sharing my experiences with those attorneys that are taking on this huge leviathan of problems through using software, through using mega data analysis, and working with law enforcement and healthcare providers in order to find solutions for lessening, weakening, and fighting the war on drugs. We are realistic as nurses, and we know that it's not going to be a magic wand that can stop this, but hopefully through my presentation and those of my colleagues, we can provide the LNC and their audience with ideas, concepts, and ways where they can work with attorneys and help solve this devastating crisis.
Thank you, Joe. I can't wait to hear your presentation. You're touching on issues that can affect all of us. I'm sure that we know of, or we can think of, or somebody possibly in our family who has struggled with opioid usage. I know my brother, for example, got involved with opioids when he had a back problem, and it really colored our interactions. I have a vivid memory of going up to see him, and he was stoned, and we couldn't have any type of a meaningful visit because he couldn't keep his eyes open. So we can all be touched by this in one way or another.
This is affecting all of us, our children, our relatives, and there are interesting books out there, movies, media, and also real life. And real life will work with brilliant attorneys that are on the panel that will also resonate the very idea that it's not just a drug war. As I always say, how can you war against your own family? We're looking at solutions as nurses, as advocates, as change agents. And those of you out there who perhaps are a little timid about reaching out to the political leaders, reaching out to those in power in the hospitals and clinics, that we can make a difference. And these sorts of programs that we're going to be presenting, learning education, and colleagues of mine that'll come out will, in my view, and I'm confident about that, educate those nurses on areas of the law where opioids and the law overlap with healthcare. And I look forward to presenting this in the next few weeks. And if anybody wants to reach out, please contact Pat. I'm here for you all. And my 20 years in law enforcement as a federal attorney, working with those entities, as well as 32 years as an RN, it is my hope that I can bring both the medical camp and the legal camp, the healthcare model that's married to law enforcement, in order to provide a better idea of how we can combat this. And as the LNC, how we can help attorneys, law enforcement, and families in order to get the help that they need.
Be sure to sign up for our virtual conference at the link below. It's lnc.tips/March 2021 virtual. You'll hear Joe Flores speak about this topic, followed by Barbara Levin, who will reveal some of the challenges of working on opioid overdoses in the hospital when the patient is medicated to sleep permanently by the nursing staff or by the physician orders without sufficient nursing judgment about combinations of medications or inadequate monitoring. Sign up for the conference at lnc.tips/March 2021 virtual, and we'll see you there. Thank you so much.
Thank you. And I urge everybody to join us because this is a very, very important topic.